Well, a brain tumor is essentially any abnormal growth that occurs within the brain. There are many forms of brain tumors. Commonly, we would divide it into a tumor that originates from the brain itself, from the cells that normally reside within the brain. Those tumors, we call them primary brain tumors because they originate from the brain tissue. The other forms of brain tumors are secondary brain tumors. These are tumors that originate from another organ of the body, such as the lung or the breast or the large intestines, and which subsequently spread to the brain. The signs and symptoms will be divided into three main groups. As the tumor gets larger and larger, it exerts pressure on the brain and surrounding structures, and that results in signs and symptoms associated with raised pressure within the brain. And these signs and symptoms manifest as headaches, nausea, and vomiting. And when symptoms get progressively worse, then patients may experience drowsiness and have an altered mental status. The tumors can also present with seizures. And lastly, depending on the location of the tumor may cause weakness if it occurs in the area that controls your arms or your legs. It may cause visual symptoms if it occurs in an area that controls your vision, and it may give rise to speech difficulties if it occurs in the area that controls your speech.
The objective of diagnostic imaging is manifold. First of all, we have to image the brain to see whether or not it's a brain tumor. So the diagnosis and the differential diagnosis of the patient's condition will be very important. And radiologists will depend on their experience to tell whether something that we see on a scan is, first of all, abnormal or it's normal. And if it's abnormal, whether it's a brain tumor or something that mimics, such as perhaps an infection or a stroke that might look like a brain tumor but maybe it is not. And after we make a diagnosis, the radiologist is also responsible for pre-treatment planning. Usually that means our bread and butter, high-resolution sequences that will enable us to plan for surgery by the neurosurgeons. And this will extend, of course, into intraoperative MRI and post-surgical surveillance. And post-surgical surveillance is a very important aspect of our work, in which we follow up patients over a long period of time to see whether the treatment has been effective or successful. So at neuroradiology, we make use of several new techniques, and we are very heavily involved in translational research to bring some of these cutting-edge techniques to the clinic. For instance, we have been making use of MR spectroscopy. We have been using diffusion tensor imaging, as well as perfusion images, using both CT and MR scanning to achieve some of these purposes. Here's an example of a patient who has a low-grade brain tumor, and you can see that quite clearly on the patient's right side, which is on the left side of the image. With spectroscopy, which we use a method to interrogate not just the picture of what the brain tumor looks like, but also its chemical composition. And with the graphical representation, we can see that the normal chemistry of the brain is being depressed. It's very low. This particular peak here, which is identified with normal brain function, has been amputated and decreased. Whereas the peak that talks, increased cell turnaround, which you normally see with a brain tumor, is increased. And with this type of graphical interface, we can follow up the patient to see whether the patient is doing better with treatment or is doing not so good with treatment.
Okay, this is an example of how we are making use of advanced neuroimaging to improve the diagnostic accuracy and also to improve safety of surgery. This is an MRI scan of a patient, and you can appreciate a fairly heterogeneous tumor located in this area. There's one nodule here, another nodule here. And because this tumor is so deep-seated, the surgical risks of excision are way too high for us to consider radical excision. And biopsy was therefore advocated. We are able to now make use of MR spectroscopy, which is a technique that allows us to not only look at the pictures, but also to look at the chemical composition of these tumors, and then to target certain areas which will give us the best diagnostic accuracy. The best treatment for a brain tumor really depends on a variety of factors, the most important determinant being what type and what kind of brain tumor the patient has. And of course, we would consider other factors such as the patient's age, the patient's fitness, other medical issues as well. And at the NNI, we advocate a multidisciplinary team approach. And this team approach involves a team of neurosurgeons who specialize in brain tumor surgery, in a neuro-oncologist who is a neurologist who is specifically trained in giving chemotherapy, and a radiation oncologist with specific training in treating brain tumors. In addition to these members, we also have a neuroradiologist with specialty in brain imaging specifics to brain tumors, and a nurse clinician who helps to coordinate the overall care of the patients. The treatment is a combination. Sometimes one major modality is the sole treatment, but many times we need to combine elements of treatment options, which includes surgery, includes radiation therapy, radiosurgery, as well as chemotherapy. And the joint team approach of all professionals of all disciplines allows us to provide the best possible and the best optimal care for our patients.